Hello, I'm Stas Pilecki. I'm a final year PhD student at Imperial, working in the chemistry department, researching cancer therapy using cancer targeting plastic nanoparticles. Most people are familiar with antibodies. They're proteins that bind to other proteins, and your immune system uses them to fight off infections and so on. We're trying to make a synthetic version of that out of plastic that can achieve the same results, but in a really controllable way. So we're looking into applications in drug delivery to cancer cells. Obviously, chemotherapy has some really nasty side effects, and if you can deliver drugs in a more controlled fashion, then maybe you can alleviate some of that. We're also looking into diagnostic applications, trying to work out at an early stage if you have certain diseases, which again helps with treatment. So it's mostly the interface between biology and chemistry, using synthetic materials to bind to biological molecules. And you know how hard PhDs can be. There can be a lot of grunt work, a lot of long hours in the lab, but at the same time it's quite rewarding being able to look at a project at the end of the day and realize that you've made a noticeable contribution to it. So I think I'm on track to stay in academia after the PhD. Sometimes you get in at 8 and leave at 7 because you have an important experiment that's very time critical. Sometimes experiments have to be left overnight and you can go home at 2 or go to the pub with your friends. It really varies day to day and keeps everything fresh, I guess. But in general, working in a lab as compared to, I suppose, theoretical work, I enjoy working with my hands, and there's a lot more of that in practical work than in theoretical. A PhD is not just the process of publishing 3 papers and then writing a thesis. It's more an investigation that you design yourself as you assess your own abilities as a scientist to come up with ideas and to test them in a real-world setting. The upsides are very flexible hours. If you need to go home at 2 p.m. for whatever reason, you're typically free to. The downsides are the flexible hours, so you don't necessarily know when you'll be able to go home. It's not often a standard 9 to 5, especially in biology. If you have to look after cells, it's kind of like having to look after children. You have to feed them at least once a day. You have to go on weekends and put in the hours, but other than that, it's quite manageable. The biggest change is, I think, in undergrad, you always, to some extent, have someone kind of holding your hand. If you don't know why an experiment didn't work, there will be around you between 20 and 200 people who might have an answer. Lots of people who are specialists in this field to guide you through the process. For a PhD, there's a much bigger element of self-teaching and having to clear your own path. So it requires a lot more insight and independent research. I kind of fell into science at some point, mostly just because I always enjoyed the thrill of discovery, and you get quite a lot of that as a scientist, especially working in a fairly new field. During undergrad, I first had an opportunity to do kind of PhD level research during a few summer projects. One of them involved making a blood type test using our plastic nanoparticles. And there was one moment when we added a drop of blood to a sample, and we knew at that moment whether or not the experiment would work. This experiment, which was the culmination of 2 months of planning and research. And at that moment, when everything worked as planned, I knew that I had to experience this again, and I had to stay in academia and continue in this field. As my parents are both chemists, they, when I was a kid, would bring me into the lab and show me all of the equipment, and their enthusiasm kind of rubbed off on me. And ever since then, I started seeking out opportunities to become more involved. My dad was very keen on coming up with new ideas, and we would stay awake long into the night discussing potential brainstorming ideas. And my mum was incredibly hardworking in the lab. No one would work longer hours. And then whenever something worked well, she'd be so enthusiastic that all of the exhaustion would just fall off of her. So I guess both of them inspired me in different ways. I think it's all taking a massive shift towards personalized medicine. So this is something that we're kind of touching on with my work as well. Increasingly, you're not going to have a drug for a disease, you're going to have a drug for a person. And it'll be tailored based on that individual's exact conditions and environment. And that's, I think, going to lead to more effective healthcare. Stick with it. It's going to get hard. There are going to be a lot of long hours, as I said. Have a lot of friends working in similar fields and different fields. Get a mix of opinions from different people. Get as much input as possible from your professors, from other supervisors in the lab. Try and cultivate an environment where you can ask questions and you can be asked questions. Try to embrace academia.